Are you wondering when to introduce a bottle to your baby? Or maybe you're looking for tips to make bottle feeding easier and stress-free? You're in the right place. Let's dive into the ultimate guide to bottle feeding basics every parent needs to know. Timing is everything. Here's when you might consider introducing bottle feeding. Exclusively formula feeding parents. Start from day 1. Combination feeding. Experts recommend waiting until breastfeeding is well established, usually around 4 to 6 weeks. Returning to work. Introduce a bottle at least 2 weeks before going back to help your baby adjust. Consistency is key. Offer the bottle at the same time daily for easier transitions. Not all bottles are created equal. Picking the right one depends on your baby's age and feeding style. Newborns, use slow-flow nipples to mimic breastfeeding. Older babies, opt for medium or fast flow as they grow. Look for anti-colic features to reduce gas and fussiness. Types of bottles: glass, plastic, silicone, disposable liners. Always test the flow by turning the bottle upside down. Drops should fall slowly. Safety comes first. Sterilize bottles. Wash thoroughly and sterilize before the first use. Use safe water. Boil water for formula and let it cool to about body temperature. Measure precisely. Follow the formula's instructions to avoid over-dilution or concentration. Never microwave bottles, it can create hot spots. Always test the temperature on your wrist before feeding. Feeding time should be relaxing for both you and your baby. Hold your baby upright. This prevents ear infections and helps with digestion. Tilt the bottle to keep the nipple full of milk, reducing air intake. Watch for cues. Signs like turning away or pushing the bottle mean they're full. Oh, and here's a tip. Burp your baby mid-feed and after feeding to release trapped air. Stuck with bottle feeding struggles? You're not alone. Here are common issues and solutions. If your baby rejects the bottle, try different nipple shapes or mimic breastfeeding closeness. For excess gas, use anti-colic bottles and check feeding angles. To avoid overfeeding, follow your baby's hunger cues instead of rigid schedules. Stay patient. Your baby will adjust with time. Don't forget post-feed care. Wash bottles with warm, soapy water immediately after use. Sterilize once daily during the newborn stage. Inspect nipples for wear and tear and replace as needed. Remember, cleanliness equals a healthier baby. With these tips, bottle feeding doesn't have to be overwhelming. Every baby is unique, so trust your instincts and enjoy these precious moments. Don't forget to like, subscribe, and share this video for more parenting tips.